taking a headache history is really similar to any new complaint that you're trying to decipher, figure out, and make a diagnosis. So headache is no different. So I start with the acronym OLD CAART, okay? So O is standing for onset. So you want to ask the patient, when was the onset of this headache? Is this a headache that they've been experiencing for a long duration of time, or has the headache changed? So is this a headache that they've been experiencing since they were 5 years old, and now they're 25 years old, and how this headache is any different? So L, location. So you want to know where the headache is. Is this a unilateral headache versus a bifrontal headache versus an occipital headache? So what's the location of the pain from the patient? D, duration of the headache. So how long has the headache been going on? Again, is this a headache that's been chronic and ongoing for 15 years and now there's a change in the headache, or is this a headache that just started 6 months ago? What is the characteristics of the headache? Does the patient complain of a sharp shooting type pain, or is this more of a dull ache? And again, incorporating that into the location. So is it sharp shooting in the posterior aspect of the head, or is it a dull, achy pain that's maybe more bifrontal? So that gives you a lot of information in terms of making your headache diagnosis. A, so associated factors. So is this headache associated with anything that's new, any new trauma, any new exposure to substances, to medications, to other insulting factors? What are the aggravating factors of the headache? So is this a headache that patients find is worse at certain times of the month, certain times of the day? Are there other associating factors, such as with females, their menstrual cycle? What are the relieving factors of the headache? Does the patient take their medications and that is something that relieves their headache, or do they need to go and lie in a long, dark room for a long period of time before they get resolution of their headache? What are the treatments that the patient has tried? So has the patient tried other pharmaceutical treatments in the past that either have helped or have not helped? If they've helped, what's helped them and what stopped them from continuing to use that treatment? Or are there other treatments that they've tried, such as acupuncture or various injections that have helped with their headache? What is the severity of the headache? So is this a headache that makes patients not be able to go to work? Patients suffer with a degree of disability? Or is this something that the patient can tolerate and continue to live their life? What's the severity of the headache?